healthcare reform. I'd like to thank our sponsors of the day, Adelphi, Economic Evaluation Group, August Benefits is here. Our panelists, we are thrilled to have some real experts in the field, and they will be introduced to you. We have Todd and Arnie and John, and I'm going to leave that up to Jim McGowan. Jim McGowan is our chairman of the Education Committee. He is also our moderator for the day, and he is a provost of Adelphi University. So thank you for being here. I'll give it to you.
Thank you. Thank you very much. And good morning. Thanks everybody for coming. First of all, let me just say that I'm not one of the experts. And when the healthcare bill first was passed, I tried my best to try to figure out what is it all about and exactly, what is the big fuss all about. And I'm trying to think of a way to make sure everybody understood. And I thought of a quick illustration for everybody to truly understand the volume of what this healthcare bill is. And I don't know if this helps, but this here is the history of the Civil War. And this here is the history of baseball. This is 489 pages. That one down there is about 478 pages. The Obama healthcare bill is 1,080 pages. So this healthcare bill is bigger than the illustrated history of the Civil War and the illustrated history of baseball combined. So you go figure that out. Now, I hope we have a panel of experts that can somehow sift through this. You know one thing about the Civil War? If you get sidetracked if you go to the Civil War or baseball, it's big, and when something is that big and that voluminous, it's that confusing. And really, the public affairs type of, or the public relations approach to this seems to have been that, let's push it through, and then we'll take a look at it and read it after the fact and figure out what it's going to do. Before I introduce the panel, just to give a little bit of an idea of some of the issues, I was looking through some different comments that are out there now about this whole healthcare reform bill. I'll just read you something quickly from Joshua Miller, an article that was printed actually it came out through Fox News, so you know where their taint is. But it said, President Obama says small businesses will be big winners under healthcare reform, but some entrepreneurs and the organizations that represent them say the only thing big about the new law will be the problems and the taxes that come with it. It's going to create huge uncertainty and the potential for another downtick in the economy fed by that uncertainty. The bill will almost certainly lead to increased health insurance costs for businesses with more than 50 employees. It's going to result in a lot of people looking at the structure of their business to see how they can structure themselves to avoid horrendous penalties. That's where they started. That's the good news, okay? And when I read President Obama's, they had a summary of their proposal, which is available at the whitehouse.gov website. And that's about maybe 40 pages. When I read that proposal said the exact opposite. This is a great thing for businesses, going to save a lot of money. I'm not so sure which one is right, and I think that's where the confusion lies. It seems that, again, according to this impact on small businesses, the four biggest issues we're seeing is that states by no later than 2014 must establish what they call small business health option program. I'm sure you guys will talk about that, the SHOPs, which will enable small businesses to pool their resources to buy insurance. The second major one that I'm reading consistently is that until the SHOPs are established, businesses with 10 or few full-time employees earning less than $25,000 on the average will be eligible for a 35% tax credit. Firms with up to 25 workers who average up to $50,000 will receive partial credit. And while businesses with more than 25 workers will receive no credit. Everybody getting this? Okay, good. And then those tax credits, okay, there'll be a quiz, by the way, at the end. You gotta remember, I'm from Adelphi, there's a test at the end of every seminar. Those tax credits will remain steady at up to 50% of cost for the first 2 years any company buys insurance via state exchanges. And then beginning in 2014, and that's what I think everybody seems to be looking at. Almost like that, remember Y2K, something's gonna happen in 2014. We're not sure what. Under the reconciliation plan, firms with more than 50 employees must offer health care to employees or pay penalties up to $2,000 per employee for all but the first 30 workers. So, with all that in mind, and I'm sure there's a lot more that I'm not even function on, okay? The volume of it and the impact seems to be out on the, we're on the fence on exactly what the impact's gonna be. That is why we thought that not only is it a relevant topic for small businesses, it's a very important topic for small businesses. I bet you if we have this seminar again in 2014, the attendance will be quadrupled, because then everybody's going to be panicking and going to go, well, I should have thought about this 3 years ago. Hopefully, you guys will be able to take something back to your businesses, or as advisors, your capacity as a consultant, perhaps, and help other businesses get on board so that they don't get shocked in a couple of years. So, as a result of that, we have put together a very distinguished panel. I'll introduce each one. We're going to go through a series of questions. We did solicit questions to several people, say, what would you like us to address? And I also, for your information, on each table, there are index cards, blank index cards. So as you're going through this seminar and all of a sudden something comes to mind, or you have a question on your mind right now, and you're saying, I really am coming here with this one particular issue I got, write it down. I'll come around as the panel is doing their presentation. I'll pick up any questions that are on the table. And we'll try to keep it informal. I think it really should be a Q&A kind of thing. If we actually did a lecture presentation on the healthcare reform bill, I don't think anybody would stay for more than 10 minutes. You grab your coffee and leave, So I think it's really more pertinent to just let's kind of work through what we think are the biggest issues. So with that being said, our first panelist, John Klimchak, is the president of Economic Evaluation Group, Incorporated. He specializes in employee benefit. He is a member of the Society for Human Resource Management, National Conference of CPA Practitioners, Nassau Suffolk Chapter of the Financial Planning Association. He's been published many times in Long Island Business News on topics related to strategies that can be used to reduce employer health costs, as well as providing guidance with respect to the recently passed healthcare reform. John has also been a keynote speaker and panelist for private business lectures for accounting firms, and was a speaker at the Huntington Chamber of Commerce. Again, there we go. Arnold Haskell, CPA, has 30 years of experience in public accounting, giving him a broad experience in advising and assisting clients in a variety of industries, including manufacturing, construction, real estate, retail, and wholesale distributorship, and medical practices. Tax services include corporate and individual income tax planning, estate and gift tax planning, tax research, tax return review, and compliance and any other tax-related function. Prior to entering public accounting, Mr. Haskell was a field agent for the Internal Revenue Service, conducting tax audits of businesses. You still have connections there, correct? Okay. We're taking down everybody's name just in case.
They're all right.
And Todd Bellistri, the president and CEO of August Benefits Incorporated. Mr. Bellistri specializes in working with corporate and executive clients. He's a graduate of California State University and holds a degree in international business. He's earned the Accredited Investment Fiduciary Professional Designation, AIF, awarded by the Center for Fiduciary Studies, which is associated with the University of Pittsburgh Center for Executive Education. And he has received formal training in investment fiduciary responsibility. He holds professional designations as a chartered life underwriter, chartered financial consultant, registered health underwriter, registered employee benefits consultant, and a certified COBRA administrator.